Hello, my name is Megan Groves. This is for our Enroll Lab, and this is my physical assessment. First, I would check my computer and see that a physical assessment's due at 7 in the morning, so we need to do an initial assessment. So hi, my name is Megan. I'm going to be your nurse today. We're going to start with a physical assessment this morning, do some vital signs, look you over head to toe. Stop me anytime, let me know if you have any questions.
Okay.
Alright, I'm going to pull the curtain for privacy. And wash my hands.
Okay.
And can you tell me your name and date of birth?
Yep. My name is Jody Lynn Doring, 52277.
Okay. All right, and that's correct. And Jody, what are we doing this morning?
I think we're gonna do the assessment I been in the hospital here, and that's what everybody's been doing at this hour of the day, I guess.
All right. So level of consciousness is alert and orientated times 3. I'm gonna go ahead and get your vitals.
Okay. My shirt's kind of tight on my arm. Is it okay?
Yep.
Like that?
Yep. I think it'll be okay. If it's not, we'll just redo it. Go ahead and just relax your arm. Okay, Jody, it's gonna get tight here. All right, 112/68. Does that sound about right for you?
Yep. I usually run pretty low.
Okay, this is gonna check your oxygen. And while I'm looking her over, I'm also assessing for hygiene. Are you having any pain today, Jody?
No, nothing more than the normal aches and pains I normally have, but nothing bad.
Okay, temp is 99. Count your respirations here. Okay, 98% and pulse at 68. I'm just going to go ahead and double check that. And what's your height and weight, Jody?
Oh, God, that's every woman's favorite thing. 6'1", 195 pounds.
Okay.
At least that's what my driver's license says.
Alright. Okay, Jody, with a typical head to toe assessment, we usually start at the top and work our way down.
Okay.
So I'm going to go ahead and inspect your skin at the top here.
Okay. You want me to take my glasses off?
Yes, please. Okay, I'm just going to kind of look at your scalp.
Well, I colored my hair yesterday. Can you see that?
It looks good. It looks good. Alright. Going to go ahead and pull back your ear here.
Okay.
And say ah. Okay, and I'm just gonna measure, make sure see if your pupils are equal. Looks like about a 5. Okay, and shine the light. Reactive light. Okay, and then can you watch my pen light with your eyes? Good. Okay. Let's see. Check your temporal pulses here. Okay. All right. And can you go ahead and move your neck around for me? All right. Anything hurt?
No, feels pretty good.
Any complications?
No.
All right. So, looks like your Face symmetry is all good.
I think so. I
Yeah.
don't feel droopy.
Yeah, nice and even
Okay.
on both sides. Alright, so on to the next.
Okay.
Okay, I'm gonna go ahead and test your muscle strength.
Okay.
Can you squeeze my fingers?
Sure.
Alright, and push down. Okay, good. And then can you push out with your legs? Alright, good. Okay. I think I'm gonna do your cap refill here.
Okay.
Good. And then skin trigger right below your clavicle. Good. Alright, let's listen to your lungs.
Okay.
And there's 8 spots on the front and 10 on the back. So I'm going to move the stethoscope around, and as I move it, please take a deep breath.
You bet.
Okay. Good. Okay. I'm just going to lift up your shirt here. Okay. I'm just going to come down. Alright, good. Also inspecting the skin on the arms. Her skin was warm and dry. Alright, now I'm going to do lung sounds on the back.
Okay.
Okay. Alright. Back of the skin looks good. And Jody, did you have any surgeries or accidents that have ever affected your respiratory?
No.
And are you feeling short of breath at all?
No.
At all today?
No. And I don't smoke, so no, I feel fine.
Alright. So now I'm going to listen to her heart sounds. There's the aortic and the pulmonary, and then the mitral valve, and the tricuspid. And I'll listen to the apical for a minute. So, the aortic here. And pulmonary. Okay, S1, S2 sounds nice and regular. Okay, and then the tricuspid. And mitral. Okay. Alright. Okay, Jody, we did lung sounds and heart sounds, your skin. I'm going to go ahead and do your reflexes while you're sitting up.
Do you care if I put my glasses back now?
Yeah.
I can't see very good.
Go ahead.
There we go. Okay.
Alright. Okay, I'm just going to have you rest just relax your arm here. I'm just going to find your brachial muscle and give it a little poke just to test your reflexes. Okay. And relax.
That one really jumped.
And,
Okay.
Alright. Alright.
I haven't had that done for a long time.
Reflexes look good.
Okay, good.
Okay, go ahead and lay down.
Okay.
We're gonna do the bowel. Okay, and are you having any problems urinating or pain or difficulty? And when was your last bowel movement?
Today.
Good. Alright, I'm gonna go ahead and inspect the abdomen. Okay. And while I'm inspecting, I'm looking if she has a colostomy or just anything that looks unusual, and I would question about it. Inspect, auscultate. Okay.
I did have some surgeries. I had a lap chole, and I had an appy, and a C-section.
Okay. Any complications with those?
Other than ugly scars.
Alright. I'm gonna go ahead and push. Tell me if you have any pain. Okay. Alright. Skin looks good. Alright, Jody, I'm gonna go ahead and keep working my way down.
Okay.
I would check the femoral pulses and then the popliteal here. Okay. Alright. Skin's nice and warm. And then the dorsalis pedis. No signs of edema. And then the pectoral tibial? Posterior tibial? Posterior tibial.
Big words.
Yeah, you know. Okay. Oh, they're good. Cap refill on the toes. And then can you point your toes towards your nose?
Yep.
Alright. Any pain with that?
No.
No? Okay. Warm and
I
dry.
always have cold feet, but I don't have any circulation problems.
No, your cap refill is good. Alright, go ahead and sit back up on the bed. Now I'm just going to have you stand up a minute.
Okay.
I'm going to do it's called the Romberg test.
Okay.
So I need you to keep your feet together and close your eyes. Just kind of, yep. And close your eyes. Alright, you can go ahead and take a seat. And now I'm going to do like a little memory test.
Oh, okay.
So I need you to remember 3 words for me.
Okay.
Red, cat, and bike. Okay? I'm going to ask you those later. It's just a little memory test, alright? Alright, now I'm going to test the central nerves.
Okay.
The first nerve is scent.
Oh, okay.
So I'm going to have you smell something. You just tell me if you smell anything, okay? Go ahead and close your eyes. Alright, go ahead and smell.
That smells like rubbing alcohol.
Oh,
Yep.
Alright, the second cranial nerve, I'm going to have you cover your eyes and then read a small print.
Okay.
Or cover one eye and read a small print, okay? So go ahead and cover one.
Okay.
Okay, and can you read this word for me?
Elementary.
Alright, and then go ahead and cover the other one. And then read this word for me.
Agency.
Okay. Alright, the third the cranial nerves 3 through 5 is the 6-point gaze, which I did when I did your eyes.
Did this?
Yep.
Okay.
Yep. And the 6th cranial nerve is just kind of a sensory feeling. So I'm going to kind of put something to your face,
Okay.
and I just need you to tell me if you can feel that, okay?
Okay.
Alright.
Yep. Kind of tickles.
Alright, and we're just going to do over here.
Yep. I'm going on my right cheek too.
Okay. Alright. We're going to get rid of this. Alright. The 7th cranial nerve is just kind of a face. Can you go ahead and raise your eyebrows?
Let me see.
Yep. And then smile. Alright. And the 8th neck cranial nerve, I need you to say ah, and swallow. Alright. Sounds good. Okay. The 9th, 10, I'm gonna whisper something. I need you to tell me what I'm whispering, okay?
Okay.
Alright.
1, 2, 3.
Okay.
1, 2, 3.
Alright. And for the 11th cranial nerve, can you shrug your shoulders for me? Good. And for the 12th cranial nerve, I need you to stick out your tongue and say light, night, tight.
Light, night, tight.
Good.
That was weird. I've never done that
Yeah.
before.
And do you remember those 3 words I asked you to say?
I think it was red, cat, bike.
Yep.
Is that right?
Yep. I had to think for a second, so I'm like, what was it? Alright. So, just need to think. Look you over head to toe. I think I hit every point. So when the physical assessment's all said and done, I would document just a summary of the physical assessment, any abnormal findings, and what I did with those abnormal findings, reporting it to the doctor, how she tolerated the physical assessment, and anything else that I feel like would be important for the doctor to know. And that's my physical.
Did you find anything concerning?
No, you seem like a
All right.
healthy female.
All right, good.